Hi, my name is Arvind Nishtala, and I am a non-invasive cardiologist here at MarinHealth. I consider myself an expert in advanced cardiovascular imaging, and I'm here today to talk to you about echocardiography and our cardiovascular imaging program here at MarinHealth. We consider echocardiography to be the workhorse of cardiovascular imaging. It is one of the oldest imaging modalities and has been around for several decades, but it has experienced several groundbreaking improvements and progress in that time. Echocardiography uses high-frequency sound waves, or ultrasound, to obtain crisp, clear images of your pumping heart. We use echocardiography all the time in our cardiology clinics and in the hospital setting as well. Most patients who come in who are referred to our cardiology clinic get an echocardiogram. An echocardiogram is used to evaluate your heart's structure and function. It allows us to evaluate the pumping mechanism of your heart. It allows us to look at the 4 heart valves. It allows us to look at the sac that the heart sits in, which is known as the pericardium, as well as the aorta, which is the main blood vessel that the heart delivers blood to. Let's talk about how an echocardiogram is performed and what your experience will be when you come to our clinic to get an echocardiogram. It's an extremely safe test and takes about 40 to 60 minutes to complete. You're going to be in extremely good hands with our experienced cardiac sonographers, like Renee here. When you come in for your appointment, Renee will bring you into a room just like this and have you lie on your left side on a table. He's going to apply 3 electrodes on your chest to chart your electrical activity as your heart beats so we can coordinate it with the pictures that we get. Following this, he will use an ultrasound probe just like this one and put some gel on that probe in order to get good, crisp, clear pictures. He will apply the probe on your chest to take pictures of your heart. He will move that probe around to different areas of your chest to get pictures of different areas of the heart muscle. You may be asked to move slightly in order to get better pictures of your heart. You may also be asked to hold your breath at times so that we can get good pictures of your beating heart. As the burden and complexity of cardiovascular disease continues to grow, echocardiography has served as the leading edge for the advancement of our field. We use echocardiography to gain a deeper understanding of your heart's morphology and physiology. We use echocardiography to identify subclinical disease or disease in its earliest stages, as well as to diagnose clinical disease. We also use echocardiography to determine the severity in disease and guide treatment decisions. We use echocardiography during our treatments in the operating room as well as the cardiac catheterization laboratory at MarinHealth Medical Center. Finally, we use echocardiography to determine the success of treatment and monitor the stability of your disease process or for progression of disease. In summary, we use echocardiography across the full spectrum of cardiovascular medicine, and this program here at MarinHealth Medical Center offers excellent cardiovascular care as a part of your patient experience.